Although you can't tell by looking at her, Alyson Bolts isn't like every other girl on her volleyball team. She's had a chronic lung disease for 13 years.
When Alyson was 9 months old, she had a series of different colds and little problems that she didn't seem to be getting past.
She wasn't absorbing her food, so she wouldn't sleep at night. You'd give her a bottle, expect her to sleep all night, and in the middle of the night she'd wake up and they'd say, oh, don't feed her again, but it was the only thing that would put her back to bed, back to sleep. So that and the antibiotics she started taking routinely just didn't seem normal.
After a series of tests at Children's Medical Center, Jean and Patrick Bolts learned that their 9-month-old baby had cystic fibrosis.
Cystic fibrosis is a disease in the lung of primarily too much mucus and thick mucus. And if you keep excess mucus out of the airways, you don't get chronic infection. Mucus is a breeding ground for bacteria, and that in the long run is what causes the majority of problems with cystic fibrosis, is chronic lung infection.
In her situation, a lot of it is preventative. We're trying to keep the disease at bay. We're trying to keep the situation in check. That's not the situation for all CF children.
Alyson has been receiving treatment at Dayton Children's since she was diagnosed, and as Dr. Robert Fink puts it,
Alyson is one of those model patients who does most of the things you want to do, and her family is very supportive.
To keep her CF in check, Alyson must spend time every day taking treatments at home, although she combines those treatments with more typical teenage distractions.
Twice a day for 30 minutes, I take a vest that blows up, and then I sit on a little button thing that makes it shake to clear up some more of the mucus that is in my lungs and make it more easier to cough up.
And the vest is something that, the biggest thing for us is that it creates independence. She can do the vest herself without our help, and that's something that, just has helped her to kind of move away from needing us to do the treatments.
Alyson continues to lead an active life. She's a leader on her school volleyball team, and she doesn't let her disease defeat her or affect her play.
She works so hard and never lets up. Never asked for any breaks or anything like that. I was really surprised to know that she had any condition. Middle, there you go.
Yes, the exercise is really good. It, kind of like as if a treatment thing, it clears up a lot of the mucus and just keeps me more healthy.
We didn't realize it, obviously, when Alyson was diagnosed, how lucky we were until we needed Children's Medical Center.
13 years, this is no kidding, 13 years, you go every 8 weeks. So I don't know what, you can figure that out, but honest to goodness, I cannot remember one negative experience, really.
The staff is awesome. They all work together as if they're one big family. And when they do find a problem with my lungs, as if like my pulmonary functions were low, they just support me and tell me here's the medicines, take them, you'll get healthier, and then it'll be all back to normal.
Alyson is a healthy young lady with cystic fibrosis, and she will need medications and chronic medical care for the foreseeable future. But she should be someone who goes off to college, gets an education, a job, a husband, and hopefully children. Her life expectancy is limited only by keeping her in good health, and the future, I think, looks very bright.